Hello.
Hi, everybody. This is not Dr. David. So Dr. David was busy today. He's not sick or anything, but he had a conference and training stuff. So Scott asked if I would hang out with him tonight, and I said sure, because I actually really enjoyed them when we do them together. But we started right before the recording, and I wanted to get this on record of. So Scott is one of the facilitators for the Men's Sex and Porn Addiction 101 work group that goes through the Sex Addiction 101 workbook. Hold up the workbook.
Here's the workbook. Yay, this is our workbook.
So the next group starts October 3rd. On a Saturday morning, and it's a 90-minute series, and or it's a 90-minute session for a 6-week series, but it goes through the workbook. And I've heard such good things from the guys that have joined it. So no more than 25 men in a group, facilitated time to step through, very structured time to go through the workbook. So I talk to people often and say, have you, there's a book, Sex Addiction 101, in the workbook. Yeah, I have that. And I'll say, have you read it? Have you gone through it? Well, no. So this is structured time to help do that. And I think really, and you can probably speak to this better, Scott, but the opportunity to think about things differently than you might read them on a page. What are your thoughts on that?
Yeah, you can go through these exercises on your own, but to have a lecture that goes with it, and it's very interactive, and Jason and I, who are the facilitators of the group, depending on which session you sign up for. We're very interactive. We get examples, and guys get to know each other and support each other. This is for the men's group. We also have a women's group coming, and a couples workshop coming.
Yes, the couples workshop will begin on November 7th. And that will be a facilitated 6-week course. So again, there'll be a lecture, but it'll be interactive. So with that, unlike a webinar where it is, you don't see each other, you will have the opportunity to connect small groups for the couple series. And then the women's will be very much like what Scott and Jason are doing with the men going through the Sex Addiction 101 workbook, but Lacey Bentley, who does the women's groups on Tuesday and Thursday night, will be facilitating that. So for those of you joining us, Scott and I are here. We're happy to answer questions.
I have a little bit to talk about before we take questions.
Fantastic. I'm glad you're so prepared.
So if you want to ask questions, use the Q&A feature, and Tammy and I will be happy to answer anything about addiction or recovery. But I was talking to somebody earlier, usually something from my life ends up on here. And we were talking about this individual's triggers. He was trying to identify them. He's a recovering sex addict. And so I thought, we'll talk about triggers tonight. So triggers are, and this is applicable not only to addicts, but to partners of addicts, non-addicts. I mean, this stuff, just take it in for your own situation, whatever you're going through. Triggers are catalysts. They're feelings, thoughts, events, experiences that trigger our desire to behave in a certain way. With addicts, we get triggered to engage in our addiction. A lot of times partners of addicts get triggered toward anger or mistrust or pulling away, things like that. And people in general, everybody gets triggered. You don't have to be an addict or in a relationship with an addict to have triggers. Triggers, we generally talk about them as kicking off a cycle of kind of behavior that we might regret. With an addict, it's an addictive cycle. With a non-addict, it's a cycle of behavior that's not productive or doesn't serve you. So think about it however you want. So triggers can be internal, or they can be external, or they can be both. So internal triggers are mostly thoughts and feelings. Internal triggers: shame, fear, isolation, loneliness, boredom, stress, anxiety, depression, resentment, all of this stuff. When I feel those things, I'm going to speak for myself. When I feel those things, my immediate reaction is, I don't want to feel these things. And as an addict, I'm immediately, my go-to coping skill when I don't want to feel those things is to slide into fantasy. I'm going to fantasize about alcohol or drugs or sex or porn. I'm going to just slide into that fantasy, and that fantasy takes me out of my head. Now, the addictive cycle, that's the first stage of the cycle for an addict is triggers, and then we go into fantasy, and then we start ritualizing. I go online, or I go drive through a certain neighborhood. I'm not actually acting out yet, but I'm taking steps. And the next stage is that I act out, and then I have to deal with the aftermath, which spins me right back around to triggers. Because usually I feel shame about what I just did, and I'm feeling more powerless than before. Plus, whatever it is that triggered me in the first place, whatever feeling I was trying to escape is still there. So now I have that feeling plus some extra shame and maybe some consequences to deal with. So that's how the addictive cycle works. And the behavior cycle for a non-addict works the same way, except it's not fantasy about it. In addiction, it's like, let's say your husband cheated on you and you're driving down the road on your way to the grocery store and everything's great, and you look up and you see a billboard and there's a woman on the billboard and you think, I wonder if she looked like that. And then you're off and running and you can't help yourself. It's natural to do that. So don't beat yourself up, but recognize that you're triggered by an image up there that may have nothing to do with reality, just like an addict can be triggered by a thought or a feeling that may not be related to reality. And suddenly you're engaging in this cycle of behavior that does not serve your life, does not make anything better. So when we can recognize our triggers, we can do something about it. That's why I wanted to talk about triggers. The billboard example is the second type of trigger. That's an external trigger. It's something outside of yourself that triggers. Somebody looks at you funny, somebody says something not very nice to you, you see something, you hear something, you have a fight with somebody, and it triggers you. Whether you're an addict or a non-addict, you're triggered into your coping behavior or your runaway train behavior in the head between the ears. It's kind of this, it starts the same place, it's the runaway train. And then we can also get intertwined triggers. It starts maybe with something external, like my boss yells at the person next to me, which is an external trigger, but it triggers in me memories of when my father used to yell at me, and now I feel shame and fear, and I'm having internal triggers with that external triggers, and then I drive home and I go past the massage parlor where I used to get my massage, and that's an external trigger, and it can snowball. So triggers, with an addict, the cycle is triggers, fantasy, ritualization, where you start taking some actions on the fantasy, and then acting out, and then numbing and despair, which leads right back into triggers. Despair is a trigger. So all the feelings we have there at that last stage of the cycle are the same feelings as the first stage of the cycle, which is why it just spins and spins and spins. It's the same for non-addicts. Where can we stop the cycle? Tammy, where can we stop the cycle?
I prefer to stop it at the very earliest point, because otherwise it's all the way down. Yes, yeah. So.
Yeah, I always picture it. If you want a visual, you got a really steep hill, and there's a giant boulder at the top of the hill. And when you're triggered, it kind of does this a little bit, and you can jump in real quick and shore it up with some extra dirt and some smaller rocks and steady it, if you do it right away. But once we start fantasizing, it's just going to roll, and it's just going to steamroll you and flatten you, and there's not much you can do about it. So the reason triggers are so important is if we can recognize them early and deal with them right away in a healthy way, usually by reaching out to someone who supports us and empathetically and loves us and cares for us, or going to a 12-step meeting, or doing some other healthy, going to the gym, cleaning the house, cooking a nice meal, going for a walk, whatever. It usually gives us a chance. It shores up the boulder and it keeps it there. It stops the trigger in its tracks. Yeah, that's my little rant on triggers.
Well, it's not a rant, and it's really important because, when people go, and then I relapsed, and I go, no, you relapsed back here. So when the boulder was on top of the mountain, that's when you relapsed, because you let the boulder you let the boulder go. I think it's really important to understand what the triggers are, but also to have a plan, and have the plan before the triggers hit. So, because when they start hitting, like, the train is going on the, on the mountain track, so you having a plan of, as soon as I start feeling that uncomfortable feeling, you're like, I need to, what is it I need to do? I need to call my sponsor. I need to, go to the gym, whatever it is I need to do. But I think owning it, a lot of it for me is like, I need to own, I'm feeling triggered right now. And here's what it is. Cause just that helps deflate it.
Yeah.
I was on a webinar with Troy Love this morning, and he was talking about attachment wounds. And so I thought all of those are, because if my abandonment wound gets triggered, like if it gets bumped up against, I'm going to feel triggered. If I'm, any of those, Eddie Caparucci talks about the inner child. Well, same thing, so understanding, like they all go to exactly what you're talking about, but having a visual of like, okay, I, like you were talking about, that reminds me of when my dad used to yell at me, da 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 da, and then I feel bad, I feel like an idiot, whatever it is, that I feel, but if I start looking at, well, that's a wound, it's a legitimate wound, and I need to learn how to heal that, but I need to also not go down the mountainside with the hanging on to the giant boulder that's rolling over the top of me. So
yeah, the first time somebody said to me was actually Dr. Rob, who I heard this from first. Sex addiction is not about sex any more than alcoholism is about alcohol, or gambling addiction is about gambling, or drug addiction is about drugs. And I thought, you're out of your mind. But this is what we're talking about. The basis of addiction is an addict will turn to a substance or a behavior rather than another person who might be able to help them, because other people scare the crap out of me. I learned early in life that my caregivers could not be trusted to meet my emotional and psychological needs. So I found other ways to avoid my emotional and psychological needs. I never got them met. I just avoided feeling them. By the way, ask questions, dump them into the Q&A feature. That's the bulk of what we do in this webinar. So I don't want to feel, but I can't turn to other people for emotional regulation. So, I learned early on to go into fantasy. It was books, it was playing games, it was, when puberty came along, it was masturbation. By that point, I was already drinking and using drugs. All of these things were a lot better than dealing with the dysfunction in my household. And that just carried with me through adulthood. So anytime I had an uncomfortable feeling, a trigger, I turned to my addiction. And non-addicts come up with their own coping mechanisms: people pleasing, manipulating, controlling. And these are not bad things. They're just coping mechanisms that have probably stopped working for you, which is why you're on this webinar. You feel the trigger, you turn to the coping mechanism that you don't want to turn to anymore. So we have to learn how to recognize, I'm feeling triggered. What can I do that's healthy instead of my old behavior?
And somebody had asked, what are the initial signs of triggers? And for me, I am in recovery long enough that I'm used to being pretty serene. My guts are not all in turmoil. I'm not living in chaos. I used to live in chaos all the time. I don't cope well with chaos, emotional chaos anymore. So if I start feeling that, if I start feeling like I'm not connected, I'm not paying attention, if I'm feeling like, I just, when I talk to people about stuff, like the sex addiction, like you said, Scott, it isn't about sex. Like drinking isn't about, how good that kind of alcohol tastes. It isn't. It's about what it will do. It'll numb me out. It'll let me escape. It lets me detach, dissociate. So when I start feeling like, compulsively, like I just need to get out of here, or I want to go, compulsively play a game on my phone, or I want to, go shop on whatever. Whatever. If I start feeling those kind of compulsive feelings, like I need to go to this, for me, I need to go, well, what do I really need to do? And the more I'm doing things that are, I don't feel like that very often, thank goodness, anymore. But I have during COVID, I'm going to be honest, like you know, I like, at one point my husband was like, I think you should call your therapist. Now, bless his heart for being brave, you know. But I was like, he's right, you know. So I scheduled an appointment with my therapist, but I also went, okay, like that was, I don't know, you know, a couple days out. So I made a point of like, what do I need to do? And, you know, I jumped into more mindfulness stuff and meditation. I mean, like I did all the things that I know are helpful for me. And by the time I talked to her, I was in a way better space, but she also gave me, you know, some more, you know, she reminded me that I could start my day with intention rather than letting my day start me. And I was like, that was huge for me, just to be intentional. And so I have since then created a little, you know, and I have done it every day of like, this is what I'm going to do. And this is how I'm going to start my day. And I'm feeling much more, you know, on track again. So just being intentional and recognizing, but also listening to other people. I mean, honestly, you know, other people might notice before you even do, you know, so being willing to be vulnerable enough to let them say, hey, you know, I'm a little worried about you, you know, and not bite their head off.
Yeah, I have certain friends that will just say, so, do you need a meeting? Do you need a meeting? It's like, okay, I get it. Or, you know, they'll call me and they'll say, how you doing? I'll say, fine. And they go, tell me about that. So that's a pretty obvious sign for me. But as far as initial signs that I can recognize myself, I look for somatic stuff in the body. If I'm cranky, right back, just where those bones are, right in the back. If I feel like somebody just pounded a nail in on both sides, I know that something is wrong. That's stress for me. Kind of a tingly is anxiety. Depression sits in my stomach, the actual stomach. Fear moves down a little further. You know, I know where my triggers live in my body now. And if I'm just achy, sometimes that's just overworked, stressed, underappreciated, you know, kind of a whole bunch of little things together. And my body's telling me, okay, you need to stop and rest and clear your head and, you know, meditate, do some deep breathing, you know, all the little exercises. And what you really need to do is reach out to other people. But anytime I'm restless, irritable, or discontent, there's an AA acronym for you: restless, irritable, and discontent, RID. Anytime I'm that, something is wrong, I'm triggered, and I need to halt. Another acronym: hungry, angry, lonely, tired, or hungry, anxious, lonely, tired. It's usually more accurate for me. And just do a self check-in, and I say, am I hungry? When's the last time I ate? Am I angry or anxious? If so, what about, and what can I do about it? Am I lonely? And the answer to that is always pick up the phone and call somebody. Am I tired? You know, just step away and go reset for 10 minutes. I have a little meditation chair in my bedroom. I'll go in there for 10 minutes, or sometimes I'll lay down. I lay down in the guest bedroom for some reason because it's, I don't know. And I just for 10 minutes, and that's enough. I don't go to sleep or anything. I just lay down and just turn it off. And I'll come back, and usually I'm better. But when I can just you have to pay attention to yourself. You have to be mindful of what's going on in your head and your heart and your body. And the longer you're around, I think the easier it is to feel when something's not right. And then the longer you're around with that, you recognize, I'm triggered in some way. I'm feeling something or experiencing something I don't want to feel or experience.
Well, and I think you're right, but I think, you know, when I first, you know, got into recovery, it was chaos. You talked about like shutting down the negative emotions. You can't selectively shut down emotions. If you're numbing out all the time, you're also missing out on all the good. And so I was completely shut down as far as emotions, figuring out what they were, et cetera. So I think the longer I was around, I was more able to tune into those. I loved what you're talking about with the body stuff too. I noticed if I'm wearing my shoulders for earrings, I'm in trouble, you know, and I'll get that stress, you know, in the back of my neck. But for me, it's also my gut. If my gut is churning, you know, I'm going like something's off and I need to attend to it. But like the simple things, like I'm glad that you pick your guest room. It's a different spot and it's for a specific purpose. That, makes perfect sense to me, why you would choose to do those things. But being willing to go, I need to take 10 minutes, rather than, I think in addiction, we're so busy, just pushing it to the side and shoving it down, that we won't, we won't do those, basic self-care, types of things. So.
And a lot of self-care is just kind of sitting quietly sometimes and feeling our feelings, even when we don't want to.
Oh, which is, I was going to say, the worst thing ever is, for me, sitting quietly is challenging, but, and then feeling the emotions is like, oh my gosh, so, but.
Yeah, we got a couple questions in there, but I want to hit something that you brought up. When you shut down your negative emotions or the emotions you don't want to feel, you also shut down the positive ones. And David and I talk about this fairly often, the neurobiology of that. What happens with, say, addiction or any kind of intensity, high intensity chaos, a lot of non-addicts who are partnered with addicts kind of live in a chaotic state, and you get used to that. There's a lot of adrenaline and dopamine that pumps in your brain, and there are certain neurons that release those chemicals, and there are other neurons that receive it. So it kind of has to be released, and then it plugs in. And it's like, that's when the light turns on, being I'm high or I'm activated in some way. What happens with the brain is very, the technical term is plastic, believe it or not, but it basically means it self-adjusts, it self-regulates. So what happens is the neurons that produce adrenaline and dopamine and all those things, the intensity neurochemicals, they'll get rid of a couple of them. So instead of 5, you have 3, and instead of 4 receptors, it'll shut 1 down. So you don't get the same rush, and that's how we don't feel depression or anxiety or stress quite as much. We numb out, but the brain turns down the volume on our feelings. Now, unfortunately, while it's turning down the volume on our bad feelings, it's also turning down the volume on joy and love and chocolate cakes. Eventually, chocolate cake starts to taste like cardboard, and hanging out with your friends is boring. That's called anhedonia. So anyway, just throwing that out there. Let's go to questions.
I appreciate that. Okay, so the first question is, so when they, assuming the addicts, act super compulsively and get something in their mind that they need to do, like a dog with a bone, does that mean they are getting bad in their addiction again?
Well, there's a lot of reasons that somebody can act super compulsively. Addiction is one of them. So it could mean that, yeah, they're struggling with their addiction, but it could mean a whole lot of other things. I don't want to go too deeply into that. Do you have thoughts, Tami?
Well, I have a challenge when things, I think I know this is personal because like I associated good and bad. If I'm acting bad, I am bad. And so I get caught up in that. So I would be concerned if somebody, I would be concerned with what they are doing for their recovery. If you're seeing, I was talking to somebody the other day and they were, I said, it's whether it's, gaming or whatever. And they're like, oh, I do all of those, and, shopping compulsive, whatever. Like, so if there's a lot of compulsive behavior and they're not, I say, if you pursue your recovery with the same energy you pursued your addiction, you'll probably you'll do great. But I also did in the rooms last Saturday, I had a session with Dr. Todd Love. We have
Todd.
Yeah, I was like, I have to think, but he did it on ADHD. And so like, I would wonder, if there's something else going on, has that person been properly screened for something else going on? Because ADHD is a real thing. I can't wait to get the video on that. I mean, it was shocking. I try to stay up on that and I learned so much again. So to Scott's point, I don't know, more would need to be, more inquiry, more assessment. But if identify with some addictive behavior, yeah, I mean, if I get compulsive about, eating chocolate cake, that's a problem for me. If I get compulsive about anything, I need to look at why am I getting compulsive about what, even if it's running, if I'm getting compulsive about running, which is supposedly healthy, why am I doing that? So.
Yeah, and in addition to ADHD, attention deficit hyperactivity disorder, there's also obsessive compulsive disorder, which is like obsessive hand washing. The difference between OCD or counting ceiling tiles, that kind of thing, and an addiction, they both kind of get you out of your head, and they're both a coping mechanism. But addictions have a pleasure element, whereas washing my hands is not pleasurable. It's just something I might do compulsively.
Yeah.
Yeah. So there can be so many causes for compulsive behaviors.
Yeah. So yes, getting proper assessment by qualified people, can be very helpful at discerning what's going on. Next question. I am a sex addict and becoming more aware of my triggers. Are there tools that you can offer that when I am triggered, how to bounce back to normal?
Bounce back to normal. What's normal?
I know. I was like, and bounce back. So I was like, I can get myself there, but I don't bounce. So.
Yeah, there's all kinds of tools for recovery. That's kind of the term I like to use is tools. The easiest one always is to reach out to a fellow recovering addict, whether that's your sponsor or just someone in a 12-step program or from a support group or a drop-in group like we host here. That's the easiest way to deal with the trigger. If you have a partner or a family member who's empathetic and really supportive, you can say you're triggered. That can be dicey for sex addicts, especially because the partner's been betrayed. But with alcoholism or something, you can say, God, I'm really thinking about having a drink, and your partner can say, well, okay, let's do something else instead. If you're, we have the 3-second rule where you give yourself 3 seconds to turn away from the addictive thought. Rubber banding, where you wear a rubber band around your wrist and you just snap it. It's just to break the addictive thought. Before my trigger gets me too far into fantasy, take a contrary action. Now, what I like about sex addiction recovery, and I use this with the people I work with who are substance abusers as well, is a circle plan. The inner circle is your bottom line behaviors that you need to get rid of. No more cheating on my spouse, no more porn, whatever. The middle circle is slippery stuff. It's triggers, it's thoughts, behaviors, experiences, driving through certain neighborhoods, unstructured free time, stuff like that, slippery. The outer circle is healthy things that I can do instead of my addiction. I can go to a movie, I can call a friend and go have coffee, I can clean the house, I can make a nice dinner, I can meditate, I can journal, I can read recovery literature, I can go to a meeting, just on and on and on. There's just hundreds of things we can do instead of acting out in our addiction. So any of those things. That's why I love the circle plan, whatever the addiction or not an addiction. Kristen Snowden, who's another of our regular hosts, and I are working on a book, The 12 Steps for Non-Addicts. And we've actually put the circle plan as an exercise for non-addicts to help them, manage whatever's out of control in their life, because it's such a good exercise. So, yeah.
Well, and my thought is have a plan, and a 3-circle plan is a plan. That's a great tool to use, because if I'm starting to get into that middle circle, which is a very visual thing, you're going to go, oh, wait, I've crept into this one. Okay, I need to back out. And here's the things I can do in my outer circle that will help me, move that direction instead of, further in, to problem areas. So I love that idea.
And I carried my circle plan with me in my wallet for several years. So because I could just pull it out and go, I'm triggered. Oh, I can do this. I'm downtown. I can go have coffee. Great. Rather than acting out.
And in our digital age, you could have a copy of it on your phone and go, oh,
yeah.
There it is.
Yeah, I got sober a long time ago.
Yeah. Okay, next question. Is it common for people early in recovery to have a hard time being around children? I'm a year into recovery and feeling guilty that I have not reached out to my sister to help her with her newborn and toddler more. Whenever I'm around children in general, I think about painful memories I have with my own childhood. I'm terrified that I'll say or do something that will harm the children.
I'll take that one first.
Yeah, so I hear your fear. So, and I haven't heard this particularly. I was thinking more of like just the coping with noisy children or whatever, but you know, there is something about being around children. So I get that there's some pain around that, but I would invite you to step into it. You know, children are resilient, and at the end of the day, just having somebody, you know, hopefully you learn to love them. You don't have a relationship with them, but gosh, just having somebody that, you know, is, you know, cheering when they do something cute or whatever. I mean, giving them a hug, playing a game, paying attention to them, pay attention to them. You sitting down, like, I don't know how old the kids are, but toddlers, you sitting down and playing blocks with the kids, that's the stuff you can't do that wrong. You know, if you're there just paying attention to them, that is so meaningful. But here's the deal. I think you're missing out of fear. You're missing out on something that could be really valuable to your recovery. Scott was just talking about connecting with other people. You know, kids don't have other motivations other than they just want somebody to play with. They just want somebody to pay attention. It's to me, that's a good thing. Thoughts, Scott?
I do worry about if it's triggering trauma, basically post-traumatic stress. You know, trauma triggers are huge triggers for addiction. So you may need to do some trauma work with a therapist to resolve some of your childhood issues, because you'll carry those issues with you the rest of your life until you do the work, you peel back the layers of the onion. But part of that, I would think, would actually be around your sister's kids. My cat is making a mess as usual. But yeah, if it really is triggering for you, rather than risk your sobriety, stay away from them until you're ready, until it fits within your window of tolerance. And maybe talk to your sister and say, I really want to be part of their life. Can I do it in small doses? You know, can I do it when you're there to manage the situation so I can just be the good aunt or a good uncle? Things like that. There's always ways to manage emotional discomfort that won't trigger you into a relapse or into behavior that you regret. But yeah.
Well, yeah, I was thinking too, and I would talk to your sister, you know, and say, here's what I'm afraid of, because as a mom, I bet she's going like, I would love to have you here and just be here, you know. You know, I mean, unless you're abusive to children, which, you know, I just don't get that. You're sitting here worried about something like that. So I don't see that as, you know, from what you're sharing, you know, as something that you would do. But gosh, you know, owning it with your sister, I would be absolutely upfront and say, you know, I even have guilt about this, but I'm so afraid I'm going to do something or say something that would be hurtful to your children. You know, that would be validating to me as your sister, but it would also give you the opportunity to air it and get support around that as well too. So
yeah, your feelings are valid, but maybe not real, if that makes sense.
Yes.
Maybe not based in reality. They're based in something that happened when you were a child rather than now. So that's what I mean by
and
feeling
fear
very valid,
of,
but not necessarily.
yeah, and fear of future something happening. So yeah, connecting to little kids is, for some of us, a really good thing. So
yeah,
like I get very distracted by little children. I'm like, oh, so yeah. Okay. So next question. I had full disclosure with my wife just over 4 weeks ago. Can you offer any suggestions on how to respond or be when this happens?
Honest. Just be honest. Be truthful. Don't keep secrets. Don't tell any more lies. Be an open book. And, which is probably not what you're asking. She is probably on an emotional roller coaster right now because she's just had a whole dump truck full of information, popped into her lap. And she's going to be on a roller coaster for a while, and that's okay. That's perfectly normal. She should be on a roller coaster. If she wasn't, that would worry me. And because that's usually an indication that she's shut down. So I'd be, if I was her therapist, I'd be wanting her to open up and actually feel. And this is a situation where you get to have your feelings and your fears. You don't, you're the one who cheated. So you don't get to blame her for being on a roller coaster. Sorry. You need to be empathetic. You need to say, I really want to understand how you're feeling. Can you explain, I think you're feeling this way. Am I correct? If I'm not, can you tell me what you really are feeling? And maybe I want to feel it and understand it. It's important to me. That will help. It's important to me to understand what you're going through. That will help. Saying, God, I wish you would just get over it, will not help. So, you kind of have to be patient. And, this will go on for, a year probably until one day you'll wake up and realize, she hasn't questioned my actions in quite a while. She's starting to trust me again. Isn't that great? I'm assuming the male addict, female partner, but that's not always the case. So I apologize if I'm wrong. Tami, thoughts?
Well, yeah. And I was thinking, first of all, I hope you both have support that isn't each other. I hope she's got great support in a codependent aligned manner. I don't know what your therapists have suggested for, what was the plan after disclosure? So there should be a plan of what this kind of looks like and how you're doing the next steps, but, leaning into each of your support, being honest and truthful, being, as painful as it is probably for you and as uncomfortable, just, I hear what you're saying, or this is what I hear you saying. Is that right? Mirroring back. I've had partners say, he sounds so robotic. And I'm like, it is robotic. This is not normal. This is not natural. This is stuff that they have to learn. It will get better. But like the fact that they're trying, this is huge, but I agree with Scott too. Like over time, things, start to I say the partners start to see the breadcrumbs getting closer of like, oh, there's a little trust, there's a little honesty. So, so they start to see, the ties between them. So, but, this recovery process for each and both of you takes time. So.
Yeah, and it's rigorous honesty in every aspect of your life, not just with your partner. If
Right.
you're at McDonald's and they give you an extra dollar and change and you notice it, you take that dollar back up because that's how you need to live your life right now. You need to be perfectly honest with everyone all the time. And when your partner sees you being honest at McDonald's or with a neighbor or with your boss, she or he is a lot more likely to believe that you're being honest in your relationship as well. And I would suggest picking up a copy of Dr. Rob's book, Out of the Doghouse. There are 2 chapters in that book. One of them is on what not to do, and one of them is on what to do. And those chapters, I think, will both be really helpful for you. But whether you've done disclosure or not, those chapters are really helpful to achieving partner.
Yeah, working on rebuilding trust. And one more offering, we have the couples online workshop that will be starting November 7th. You can check it out. It's communication. It's good skills that will be taught and discussed. So on seekingintegrity.com, you can find out more about that. That may be something that you want to look into. So, okay, next question. I'm an SA husband, began recovery work 3 years ago, more so recently in November of 2019, found that the anger which drove by my shame was causing just as much, if not more, problems than SA. Wife has not begun her healing process and says she will not with counselor regarding marriage, recovery of marriage. She is working with a counselor on her anxiety only. This is her second counselor since last fall. What should a roadmap look like for a betrayed spouse, and what should recovery look like for us we are in the therapeutic separation, but she won't label or write down this separation agreement or even text it, which makes me feel as if she can't constantly shift the parameters and then say, I'm acting like an addict because of XYZ, as long as it's not labeled and written out. She has control of everything, and I can't say anything with real conviction of talking and healing. That's complicated.
Yeah. You know, first of all, the addict here has not only addiction issues, but anger issues, which is very difficult in any relationship. And then, you know, shame is driving both anger and addiction, which is not uncommon. We have a wife who, you know, basically doesn't want to be told that she's part of the problem, and I don't blame her. And so she's only willing to work on her anxiety, which she can probably, I'm reading into this, I'm making up stories in my head, but anxiety I can blame on you because you've done all these bad things. So of course I'm anxious. So that's probably, that may be where she is. It may not be. Again, I'm making up stories in my head to make sense of this. That's a very complicated situation. And, you know, what should a roadmap look like for each individual and for the couple? Wow. You know, let me tell you what you can do, the addict. And then I'll let Tami address the partner. How about that in the relationship? Sure. As an addict, you can get sober and work on your issues. You can go to therapy, you can go to 12-step meetings, you can come here, you can participate, you can work on you. You can clean up your side of the street. What your wife chooses to do, I hate to tell you, is up to her. You can't fix her any more than she can fix you. She would love to fix your addiction and your anger issues. She can't. You can. She can't. You would love to get her into recovery that will, you know, fix your relationship and do all these. You can't. It's up to her. So at this point, you need to let go of what she's doing and not doing and focus on what you're doing and not doing. And that's my advice to the addicts. Now I'm going to turn it over to Tami. And feel free to add to that. Or
yeah, well, so I'm thinking we are in a therapeutic separation, and you didn't say for how long. I'm wondering if it's since last fall too, because that's a long time. You know, and she's got a therapist, and you've got a therapist. I'm wondering if, you know, I was thinking if we had an opportunity to talk about what is the plan, because right now you're stuck in that in between, and like she's working on her anxiety, but like what does the end of that look like for her? How does her, you know, when is she going to feel like that's better? So I go very practical. It's like, you know, could there be a session with both therapists and both of you to talk about, let's get a plan. Let's just get a plan that we can, you know, we can identify and work on. I'm going to work on my recovery. You know, here's what we need to see in order to shift it from therapeutic separation to being back together again. And here's what coming back together would look like. It might be, you know, you're out of the house now and you're in the house, but in a different bedroom. I mean, like, what does that look like? Like, but so there's a plan for both of you to visualize a roadmap to here's what it would take for us to come back together again. Because if both of you, if you're left stuck in the in-between, like, unfortunately, I often see that people just go, okay, this isn't working, this isn't worth it. There's no end in sight. And so for me, both of you having professional guidance in conjunction, both of your therapists, you know, supporting each of you for that, you know, would make sense. Now, at the end of the day, if she just absolutely refuses to do any of that, then I think it's fair to say, what is your plan? How do you see this, you know, resolving? What is it going to take, so that you at least have some clarity on that? But
yeah, and you know, I totally understand your desire for the plan. That's like, I want to know, when can I expect this stage to move into the next stage so maybe we can get better. And, you know, you may want to talk to your therapist about, you know, if it's dragging on too long, and since October of 19 is dragging on too long, frankly, for me, it would be, maybe you need to set some boundaries and say, look, you know, if our therapist can get together and we can have a joint session, and create some sort of plan for moving forward in a healthy way, great. If we can't, these are the things I'm going to do to protect myself in or out of our relationship, because it does take two to tango in a relationship. And if one partner is completely out, there's not much the other partner can do. I'm not saying that's the situation here. Hopefully,
right? Yeah, we're just
that you want to get back together.
Tidbits, and I've seen it, both ways, where an addict absolutely refuses to do any recovery work, and unfortunately, the betrayed partner is like, they've remained hopeful, and there is just no evidence. There is nothing happening. But I've also seen the flip side of it, where the addict is going like, I really want, to move forward. I want, and I think the conversation is, I want us to find a healing path back together again. I don't know what that looks like. I'd like us to talk about it. I'd like us to navigate that together. And there'll be speed bumps along the way. I get it, but having a plan, no specific time frames necessarily, like, well, in 90 days this and 90, but like, here's what the benchmarks would be, the acting out behavior is stopped, and whatever it is. I don't, you and your therapist can talk about that, but the stuck, I don't like, one of my worst places to be is in the in-between. I'm really horrible at that. Even at this point, I'm good before, and I'm good, with the plan, but when it's in limbo, that is like, that's just, COVID has been tough on me being in limbo. I've had to develop tools and go, and the rest of the world is too. So, but okay, next question. Is addiction the same disease no matter the substance or behavior? For example, does an alcoholic have the same brain wiring as a sex addict or food addict? Is it merely difference in the addict was exposed at a young, in what the addict was exposed to at a young age? Great question.
Yeah, and the answer is yes and no. The brains of all addicts tend to light up in the same way. Not only when they're engaged in the addiction, but when they're anticipating engagement in the addiction. And so yes, and all addicts tend to have some form of early life trauma. Sex addicts are more likely than other addicts to have had sexual trauma as a child. Early exposure to alcohol or drugs is a huge risk factor for alcoholism and drug addiction, whether the child was using or not. Just being exposed to it in the household. So addiction is in a lot of ways the same disease, but recovery from addictions can look different. Alcoholism, drug addiction, we're talking about permanent, total, complete abstinence, gambling, no more drinking, no more drugging. Sex addiction is much more like a food addiction, where it's finding ways to engage in what is normally a life-affirming activity and a necessity for the survival of the individual and the species. Learning to do that in healthy ways rather than problematic, addictive, compulsive ways. So that's where certain addictions differ from other addictions.
Yeah, but ASAM, the American Society for Addiction Medicine,
yes.
Talks about, it's a chronic disease. And so whatever form, and I was on in a meeting one time with the former head of ASAM, and I can never get his name right, but I remember this. He said, there is no S in addiction. Addiction is addiction. And I was like, oh, because we talk about, this addiction and that addiction and that addiction. And at the end of the day, they all are doing the same thing. They're all keeping us compartmentalized and escaping. And at the end of the day, they're keeping us away from people that we love and care about. We're always putting this out there, and we're, spending 5 hours, looking at porn or on a game or whatever it is we're doing. And it still is keeping us compartmentalized in a way. So, and for a lot of people, they go, well, and I know, Scott, you've had this too, where, I'm in a 12-step meeting for one variety or another. And they're talking about something else, or like, this is classic, somebody gets into recovery, but they gain 50 pounds. Well, now I believe that they're using food in the same way to numb out, and escape, that they did whatever else they were doing. So if we don't heal those underlying issues that Scott talked about earlier, we're going to just keep bouncing from one thing to the next. So if somebody's confused about the statement that you made, numbing out to not feel the negativity, but eliminates the positive. My husband said that when he had an affair, it was fun, joyful, and he was grateful, etc. He had lots of positive feelings while numbing out the reality of having a wife and kids he had resentments against that developed from his family upset with his drinking and his anger.
Okay, I can clarify that hopefully pretty easily. The first time I drank, the first time I drank most of a bottle of Bacardi, but the first time most people drink, they have a couple of beers and they get tipsy and they have a good time. And then if they, 6 months later, if they've kept drinking, they have to have a six pack to get that same high. They need more input. They've developed tolerance because of the changes in the brain, the neurochemical changes in the brain. And then they're drinking scotch. And then they're taking opiates. And then they're crushing the opiates and snorting them to get a bigger hit off the same drug. And then they're shooting heroin. Nobody starts out shooting heroin. Nobody wants to be a heroin addict. Nobody wants to inject drugs into their arm to get high. But we get there because of changes in the brain. Now, so we keep escalating to get to be to a point where we can get that high, the fun, the joy, the whatever. So your husband has escalated his behavior until he was having an affair, because the affair gave him the intensity level that he could feel the same high that he maybe got when, 10 years ago when the two of you just sat on the couch and held hands. So that's what happens. And eventually, and maybe he didn't get to this point, eventually when you can't feel anything, good or bad, because you've shut it down so much, that's when anhedonia sits in. Like a heroin addict calls that chasing the dragon. I'm not trying to get high, I'm trying to get back to zero. Because my brain, the pleasure center of my brain is so damaged from my addiction that I have to use huge amounts of heroin just to feel normal. I can't even get high anymore. Your husband obviously didn't hit that stage, and good for him, because nobody wants to hit that stage. But does that clear it up? Do you think did I answer the question?
Yeah, and I had to think about this because I was like, okay, I remember, which is, so one of the things I remember is when I got into early recovery, somebody said, "What are you feeling?" And I was like, "I don't know, I'm just feeling, and I hate it," and I really did. Now, the people that saw me doing all the stuff that I was doing would have thought I was having a grand old time. And I was, and I am 100% confident I was lying to myself at the same moment going like, this is amazing, but I also had the shame and the guilt and everything else. Like the next day I had to go do all this stuff over again because it was like, oh, it was terrible. Now, what I see too with your husband is very compartmentalized, because I have to not think about, or even like you're saying, he has resentments. He had to come up with anger and resentments about you and the kids, ugh. So that I can go do all this because I deserve to do all this because, oh my gosh, my family is, it's such a burden, it's so terrible, BS, I'm sorry. But that is one of those, if there's resentments and things like that, the adult way to handle that is we've got some issues. Maybe we should go see, some professional to help us do this, and I don't know what he's got resentments at the kids for. They're kids and they deserve two parents that are helping. So to me, that feels like a very immature response, but also one that's very compartmentalized of I'm going to have all the fun over here. And this is all negative, but also very positive and negative.
With you. Yeah, I completely agree with you that blaming someone else for your behavior, it's a common form of denial. Pour me a drink.
Yeah.
So.
So I recently visited a place that was a middle circle type place, and my brain subconsciously justified it so well that I had no idea that it could be a problem. I didn't realize it until I told my wife where I had been and wasn't happy. She was a very hurt spouse. It was very much autopilot. Any advice on how to catch that?
Yeah, this is the kind of thing that if you have a circle plan, um, it will help with that, because that will show up in your middle circle. Uh, and you will know, I can't go here. I'm an alcoholic. I can't go to the bar. I can't go, even if I'm not drinking. I can't go. If I'm a sex addict, I probably, maybe I can't go to a bar because I picked somebody up there once. You know, that'll be in my middle circle. Yeah, have a plan.
Yeah, well, and I'm going like we talked about earlier, you made the decision long before you ended up in the middle
Yeah.
circle place. So back here where you're starting to go, and Scott talked about HALT, hungry, angry, lonely, tired. I call it HALT, hungry, angry, lonely, tired, stressed. If I'm all stressed out, what do I need to do to take care of myself so I'm not putting myself, so that I have the most bandwidth to be able to go and recognize that I'm stressed out. I'm going to be more vulnerable to those middle circle and inner circle behaviors than I would be if I'm doing the things that I'm taking care of myself. How many things are you doing that are on your outer circle? Like, if you're going like, well, I haven't gone to a meeting and I haven't called my sponsor and I haven't seen my therapist in a month. You made the decision by those behaviors to let yourself slide into the middle circle. My thoughts anyway.
Yeah, but just one other thought here. Kudos for telling your spouse.
Yes.
As hurt as she is, she would rather hear it from you right after it happened than hear it 3 days later from her friend. So
Yeah.
good job there. That's
Yes.
Tell the truth, tell it faster. So good job
Yes.
with that.
Yeah. And don't let it get to be on autopilot. I mean, it can be exhausting. I was telling my husband about this. I was like, I have to think and think, because I know my brain still makes, goofy things. And the story I tell myself is, so I have to do that. So you being in connection with people, I'm glad you're here, but you being in connection with a sponsor, you being in connection with people who can help you look at that, they always call it stinking thinking, when I was early in meetings. And I was like, just so that it doesn't get to be autopilot, that you go, no, I still have the plane. Okay, next question. I'm a betrayed partner. A few weeks ago, I shared my impact letter with my husband with our 2 counselors. Overall, it went well, though I think my husband's initial reaction has been more, yes, I did all those things and I own it, though he hasn't seemed to really process all the hurt it caused. I am hoping that that will come as he continues to process and as he works on his restitution response. And actually, I am seeing some small changes that show he is a bit more attuned to checking in with me. Baby steps. Is this typical reaction? Yes.
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 Just
Yeah.
yes.
Yeah. But like I was saying earlier, it's like we don't know how to do all of this. We have to learn, and it's going to feel like a robot. I understand, but it takes time to be able to, to do that, and to have genuine empathy. So I love that you're seeing progress. I mean, yay,
Yeah.
you're seeing
Baby steps is good.
baby steps forward is fantastic. So,
Yeah.
so there's lots of hope, as I hope he keeps doing what he needs to do. And I'm glad you're here. That's great. One more question and we have time. How many sessions of EMDR is generally recommended? I went through my 4th EMDR session last night to help resolve a painful sexual trauma at age 5. I had to take a small break in the middle because of the emotions were so overwhelming. I've calmed down since then, and I'm wondering if I should continue more EMDR or alternate EMDR and talk therapy.
I don't think there's a pat answer to this question. I think you need to talk to your therapist about the proper course of action to take. Everybody's different, and I love that you and your therapist were smart enough to take a break when it got too overwhelming. That's how it's supposed to work, because trauma treatment, whatever path you take toward trauma treatment, EMDR, tapping, whatever it is, it's tough. So I'm glad you're doing it. I'm glad you're taking it slow, it sounds like, but run past your therapist, I guess.
Yeah, and maybe you do need to have some talk therapy for the next few sessions, and then do a little bit more work. And you know, and I can only speak for myself, but I've had EMDR, but it's always been within a talk session. It wasn't like I've never been in one that was all EMDR. It was like something came up, and you know, so my therapist said, let's do a little EMDR on that, you know, and I would do that, and unbeknownst to me, I'd be crying, and, you know, like, but the feeling, you know, and she always gives me like a message to say, like a positive affirming message to say as I'm tapping. But so I love Scott's, his thought of talk to your therapist, see how you can do both. But clearly I'm thinking it's also, you know, it's touching on things. So so hopefully you get some relief through the EMDR as well. So.
A good trauma therapist will always work very hard to keep you within your window of tolerance, which is why you took a break in your last session. You know, your therapist recognized, oh, we're getting out, we're getting outside the boundaries here.
Yeah.
Let's stop for a while. You know, and it doesn't all have to be resolved today.
It won't all be resolved today.
Right. No. Yeah, the longer I'm in recovery, the more layers of the onion there are. That's just, and you know, I love the onion analogy, because we peel back the layers of the onion and it makes us cry. And you know, with trauma, every layer we peel back, we cry, and that's the way it is.
Well, and because like I hated that for a while. I was like, I want to be done. I want to be all wrapped up with a bow and be good. And then I had this thought that I appreciate more where I am now than 2 years ago. And in 2 years, or whatever frame time, 2 years from now, I want to be able to look back and go, I've made more progress. So I was willing to do the work because of that. Because, you know, like I was just like, you know, I hate being in the in-between. I want to be done. I want to get, you know, I want to get the finisher medal, you know. That isn't how this is life. That's not how it works.
So. Cool.
Thank you. This was fun. Thanks for letting me.
Well, thanks for coming in and joining me. It's always more fun with someone else. Thank you, everybody, for being here.
Thanks for the great questions.
Yes, too. We'll be back same time, same channel next week with David, unless something pops up.
Stuff happens, but thank you. I will see. I will see you on Monday night with Dr. Rob, or on the Wednesday series. So we'll see ya. So thanks, everybody.
Bye, everyone.